Health Department has called for caution over the suspicion of Nipah virus infection in 2 recent deaths in Kerala's Kozhikode district. The State Health Minister Veena George has held a high-level meeting and reviewed the situation. The Health Department has said that they are going to be issuing an advisory and in fact have said that these 2 deaths following fever were reported at a private hospital. The cause for these deaths, according to the government, has been listed as quote-unquote unnatural, but it is widely suspected that these were linked to the Nipah virus. Well, Uma joins us now with the very latest. So, Uma, we don't have confirmation yet on whether these deaths are in fact linked with the Nipah virus, but there is a Nipah virus alert in Kerala. What more can you tell us?
You're right. Nipah virus has not yet been clinically established nor linked to these deaths yet, but as we know, Kozhikode has had at least 2 outbreaks of the Nipah virus. The first time that it happened was in May 2018, where in fact you had about 17 deaths that were reported. In this particular case, the first death had in fact occurred on August 30th, and that was of a 49-year-old and in a place called Varatonkara. And the second death, in fact, happened yesterday of a 40-year-old. He was a native of Tiruvallur near Vadakara, and this Vadakara happens to be near Maratonkara. Nipah virus, as you know, is a zoonotic virus, which means it spreads from animals to man, and it is also spreading among human to human. Also, there can be this spread of this virus. And what we understand from what the Health Minister has said, Veena George has said, is that there is a third person also who is said to be in the ICU, and this person is in fact related to the death that happened of the 49-year-old on August 30th. So what we understand is that his 25-year-old brother-in-law and 2 children, 4 and 9, have been kept in isolation after these symptoms of Nipah virus have been reported. Symptoms of the Nipah virus may seem almost similar in a sense to the COVID-19, because you have the sore throat and the cold that is usually reported along with that. But there is also muscle fatigue, and there is dizziness, and many people do report some kind of headaches. And in fact, in fatal cases, it's been related to encephalitis that happens, and that's in fact the cause of the deaths that happen in the case of the Nipah virus. So right now, emergency meetings are on because, as you know, Nipah virus had created such a huge scare that even a film was made, which was a medical thriller that was made in 2019 called Virus, and that was in fact based on the Nipah virus itself, the outbreak that had happened the previous year in 2018. Remember, all this happened before the COVID came, and even before that, this kind of a scare about people-to-people transmission and a virus that would be a killer virus had created a huge scare, and that's why the film Virus had come out in 2019 and was very widely watched and appreciated. But right now, the Kerala health authorities saying that they suspect that this could be a Nipah virus. Clinical confirmation has to come from the NIV, and that is something that is still awaited. Back to you.